Hi, everyone. Welcome to the first installment of our peer data webinar series. We're going to give folks a couple of minutes to get joined up, and we will get started in just one moment. Good to see you all. Welcome. Happy New Year. Good looking crowd. Glad to see some old friends and some new faces as well. All right, let's go ahead and get started. Again, welcome to the Peer Data webinar series. Today, our presentation is called The Road to Continuous Quality Improvement. We have with us Ankit Bangar from the uh, the Community Action Program of Ramsey in Washington County. Sorry about that. You guys know how our acronyms can go. I'm Terry Bearden. I'm Project Director for Organizational Capacity Building here at the National Community Action Partnership. And so let's go ahead and get started. Just as an FYI, we will make the recording of this session available afterwards, as well as the slides. So again, welcome and let's get started. We'd like to ground ourselves first in the promise of community action on the next slide. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. I would like to encourage you to put your name and agency and state in the chat, and also to add any questions or comments that you might like for us to discuss during our time together. And with that, I'm going to turn things over to Ankit.
Thank you, Terry. Hello, everyone, and thank you for joining us today in this webinar on continuous quality improvement. Uh, Again, I would like to thank Terry for organizing this wonderful web series. Um, and this is the first one for the year, right? Okay, so the title for this webinar is Road to Continuous Quality Improvement. That ROADD, you see, it's not an acronym. It's not a typo, it's an acronym that summarizes the whole philosophy and procedure to achieving measurable quality improvement outcomes. Road is also a theoretical frame and conceptual framework. But here's the thing about theory, we get too invested in theory and we don't get enough time to see how it looks in real life. And that has also been a criticism of this presentation. I've done it a couple of times that I get too much into theory and we don't get enough time to look into the actual process. So while I'll go over this acronym somewhere in the presentation, I would also allow you to relate all the whole procedure that we talk about with this acronym. And if you have any question, you can put that in the chat or ask however we want to do. All right, so let's begin our session today. Our objective today is to recognize that all agencies, all of us, we exist on a CQI spectrum. I will use CQI. CQI is the acronym for continuous quality improvement. So recognize that we all are on some kind of a CQI spectrum, whether we know it or not, and also to meet all of you, all the programs that are here today, um, meet them where they at on the spectrum. From there, we will discuss the methodology that our agency is currently using and implementing, and then we'll try to align ourselves with that process and where we stand. The success for today's webinar lies in motivation to implement the whole process or any part of this process in your current work. So I've been working on continuous quality improvement for almost 6 to 7 years now, and I've come to realization that organizations can exist on multiple stages of the CQI spectrum that I just mentioned. Let me explain how it works. So this is what I have as a concept of CQI spectrum, purely made out of my own experience in my organization, and it also shows the journey we made to reach where we at in our CQI journey. You will also notice this attention please here. I've left that symbol or logo or a sign throughout my presentation so that you can take note of those slides and be a little extra I don't know, careful if that's a word for it, about these concepts. All right, so on the spectrum, at the lowest end is the compliance phase. In this phase, there is no CQI happening. Organizations are following a list of compliance and sticking to it. For example, a large part of my role is in a Head Start program, and when I started like 10 years back, for us, CQI was compliance. Like if it says something on our performance standard, that was our CQI doing that. So compliance is where there's no CQI happening. This is the starting point. And you may be doing things and beyond compliance, but compliance is where we start this spectrum. The next stage is when organizations have some CQI related objectives, where they go above compliance, like I said. Now, these objectives can also include how to get to the compliance in a more efficient way. And that is where your journey starts in CQI. The next stage is interesting because it requires its own build up. So organizations start talking about smart objectives. So once they have some objectives, the buzzword smart objectives comes in, right? But I'll give an example. If an objective is perpetually implemented year over year, then it is not a smart objective. That is what the distinction is between smart objectives and actually real smart objectives. Uh, then the next phase is the real. We'll see these objectives later in my slides. Then is a phase for real smart objectives. We will see again, I said, in our upcoming slides in detail about what smart objectives or real smart objectives are. But this actually means following all the tenets of smart. That is smart, that's specific, measurable, attainable, relevant, and time bound objectives. The phase after that um, is the next phase we enter is creating, or what we did, which is also part of the spectrum, is to quantify the CQI. This is a new concept. Usually you do not see quantifiable CQI or measurable CQI, but this is the next phase. Once we have smart objectives, then we start quantifying it. Provides a very tangible approach to CQI outcomes. And this is where an agency like ours, we can tell our CQI score for every year or for any time period. The phase after that is pretty broad. For us, institutionalization of CQI means that we are we are conducting this whole process year over year. So if you're ever in pathways to excellence, so we talk about the longevity uh, of any process that is in place. At least it should be 2 or 3 years in place. That's also called institutionalization of any process, and this is where we institutionalize the CQI. I'm sorry, I'm a little tongue tied today with institutionalize, but yeah. Moving on. So I do want to go back to my comment I made about organization being at multiple levels of spectrum simultaneously. Organizations have various programs, like our CAP agencies have different programs, and these programs have different program goals. They have different objectives. Some processes may be easy to modify to reach the next levels of the spectrum than the others, and therefore it is okay for some of your process and projects. uh, they're just following compliance. They are in compliance phase, while some are in more advanced stages of this CQI spectrum. What matters most is the critical mass of work where it falls on the spectrum. So, for example, let's say you have 100 processes or 100 objectives, as long as like 50, 60 objectives are in towards advanced um, steps of this phases of the spectrum, we're doing CQI and we're good. Um, I also want to talk about another foundational concept in CQI. It may look like a little philosophical, but it has been inspiring us um, all these years that we have done CQI. We all have seen this concept of quality improvement. It's called PDSA. It is also called PDCA at times. It works for many industries. It may work well for many community action agencies too. But in my experience, there are a few limitations when you use PDSA, PDCA as a CQA concept. One of the limitations is that it oversimplifies the whole quality improvement process. If you do not define quality metrics for yourself, then it becomes a vicious cycle of sorts. You will keep on modifying the process without achieving uh, the intended goals or objectives. And the cycle will end with either too many iterations done over a same process or after reaching a quality improvement threshold, which should have been in place at the very first stage of at the very first iteration. It is also a very siloed quality improvement concept. By siloed, I mean each process follows the cycle in isolation with little to no systems thinking involved. And in community action partnerships, we have so many programs, so many wheels working together. So it cannot be siloed approach when it comes to CQI. Another issue is that this concept doesn't necessarily drive policy change. um, my experience may be completely different, and I don't want to make it a full blown session of talking down this PDSA PDCA model, but it just did not work for us. Um, Sort of it worked, but it not in its is not it it's in like overall in our overall CQI process. Um, what we This is where we draw inspiration from our CQI. Let me explain what this is. Quality improvement is a sum total of all the things you have done above compliance. When you look at each box in the spiral right here, it is following a Fibonacci sequence, which means each box is a sum total of last two boxes. Which means once you have defined what quality means and achieve it, you just need to make sure it is embedded in your systems, and you are taking over and you're taking over other processes as well. How this translates into real life, to answer this, imagine each box also represent one grant year, right? And quality you have achieved in year one should also be maintained in year two. I mean, we cannot just not do what we did in year one, right? And in year three of your grant, along with the new quality, you have to also do things that you have done in year two and year one. So that's what it means when that it becomes the sum total of the quality improvement things that you have done in the past. What I think works for us with the CQA concept is it allows us to define quality, um, rather than keeping it vague, like, our program will increase our outreach. I mean, that's pretty vague quality improvement objective, in my opinion. It also allows systems thinking and improving systems. For example, let's say if our outreach is not effective, then this allows you to look outside of the current process and collaborate with other stakeholders. And most importantly, it institutionalizes the quality improvement while focusing on more avenues to increase quality. Because your quality is not vague, now you can achieve the goals or objectives that you have set in terms of quality, and you can now focus on other objectives. This will be more clear once I start explaining our process. And to understand a process, we need to understand some key elements. And this is how I've broken down our process, because it's a big process. I did not know a very good way of presenting it. So I broke it down into separate elements. And we're going to talk about those elements one by one. All right. So the first key element I want to talk about is WBS, or work breakdown structure. Now, if you have read Project Management Book of Knowledge, also called PMBOK, then you would know what a WBS means. If not, then this is how you decompose your project into smaller and more attainable or manageable chunks. So basically, it's taking one task and breaking down into smaller tasks so that you can achieve that one big task. We are going to use this decomposition method for our CQI. So that's the first element. The next is broad goals. people usually talk about SMART goals. What we use is we use the term broad goals. Broad is an acronym for our organization goals. These are overarching goals that govern our work, and it stands for big picture or simply broad goals, result oriented, organization wide, aligned to the mission and direction. I assume that all of your programs have program goals, and they are pretty broad, which is also a starting point for our CQI process. These broad goals will be broken down into SMART, or rather, real SMART objectives, which is also our next concept. Okay, so SMART, just like board, is also an acronym, and this is where I'm sorry, I got a little distracted with the chat. SMART is it's also an acronym. It stands for specific, measurable, attainable, relevant time. And we have read about SMART objectives ad nauseum. Wherever, whichever management training we go to. I mean, at least I have been to. They talk about SMART objectives. We implemented SMART objectives, like I said in my opening slides. We implemented SMART objectives, but when you really look at those objectives, do they have all these five elements built in? That is a question. And once you start spending more time and efforts in creating an objective which is actually smart, then it helps the whole process. um, Just give me 1 second. While all the philosophy and elements support the CQA process and make it stronger, CQA objective is something that drives the whole. This is the thing that drives the whole process for us. I've experienced that many programs like the concept of SMART objectives, but either do not follow it fully or lose commitment halfway through, which leads to failure. And we like I said, we were also like that. So I have some examples. Like, we have this example. Program will increase outreach by end of program year. These are the objectives we started create. These are the SMART objective we started creating once we wanted to use SMART objectives. And what we noticed was that this is still vague. They are not very specific. They may look like very SMART objectives, but they're not. Compared to this one, the outreach manager will ensure outreach is increased by 20% to effectively communicate program offering in the community by May 31st, 2026. So let me break this down. There's a person responsible for in it, right? They're very specific. A person is doing something, or reaching and creating an output to generate an outcome, that is to effectively communicate program offering in the community by a certain deadline. So now this is a very specific, measurable, attainable, relevant, and time bound uh, objective. You see that time bound. A lot of time people ask, like, okay, what happens? What would you do if you have to do the same thing next year? We just change the date, and it becomes again, it becomes a time bound objective. We are doing the same work, but we are changing the time out of it, so it is a new objective for next year. So that is how we use SMART objective. This is where being a person who does CQI for our organization, this is where my most of the efforts go in talking with different teams about creating. We call it smartifying the objectives, because teams will come with their objectives and they will not be smart enough, and then I will analyze these objectives and make them smart. Um, Then another key element we have is objective status. If you have an objective, there has to be a status of that objective. We use four objectives. I'll get a chance to demonstrate how it looks like in operation or as a live view. Um, the first one is not started, then in progress, completed, and abandoned. Um, I want to talk about abandon a little bit. Rest of them are self-explanatory. During the program year, or during a grant year, sometimes we realize that maybe the objective we set in the beginning of the program year is not relevant anymore. and that's where we abandon the object. That's why that's the status exists. These status are important if you want to make your CQI efforts quantifiable. The CQI score I was talking in my initial slides, these are the building blocks of that quantifiable CQI method. So how we use these statuses, that each status is assigned a score. So if I'm sorry, if an objective is not started, then they get a score of 0. If it's started, they get a score of 5. If an objective is completed, they get a score of 10. So that's how we built a scoring system for a CQI. We have a lot of rules about how we assign these status. We'll see in the coming slides. Okay, so according to our work breakdown structure, on the top we have our program goals. Then we have the smart objectives. And now these smart objectives have 4 statuses, right? In progress, not started, completed, and abandoned. But then the smart objectives are further broken down into action steps. At a minimum, we require 3 action steps per objective. It can be more. You can break down a work into more action steps. But these action steps do not have many statuses. It's either complete or not. So we call them binary steps when we talk about the work breakdown structure, because steps can basically could be, these action steps could be further broken down, but we have this level of detail where we go at where it's either complete or not complete. Okay, so in our next slide, okay, right here. So let's say an objective has 3 action steps and none of the action steps are completed, then the objective remains not started, or it receives 0 points. Let's say one of the action items is completed out of 3 action steps, then the objective, it's switched to in progress and they receive 5 points. Then if all the action steps are completed, it could be 3, it could be 5, it could be 50 action steps. If they all are completed, then the objective stands completed and they receive 10 points. Okay, the next element is CQI scores. So you saw in the last slide how objectives are assigned scores. Imagine a community action agency with so many programs, and those programs having so many program goals and many objectives. So we average the objective scores to create a program goals CQI score. Let me open the next slide and it'll be much more clear. So let me explain. So we have these objective scores. These are individual objective scores. They are generated by the status of that objective. So again, if it's in progress, they get 5 points. If it's completed, they get 10 points. If it's not started, they get 0 points. Right? We take an average of these objectives that are under one program goal. And likewise, we have multiple program goal scores that will aggregate into program scores, and that will further aggregate into an agency score. So it's a good scale of 10 basically. And then you can call it, like if it's 10%, if it's 8 out of 10, then you can say we achieved 80% of the CQI that we promised ourselves we will achieve. So that's how we quantify um, our CQI process. Um, the next term is CQI teams. We have created teams at a program goal level. These teams are responsible for anything CQI for that program goal. So let me give you an example of our Head Start program. We have 10 program goals. So we have 10 CQI teams for each program goal. Now, there's always a team lead whose job is to follow everything that we're just talking about, like creating smart objectives, creating work breakdown structure, assigning action steps, assigning statuses, calculating the scores. So they may not be directly responsible to complete the actual objectives, but they're just doing the logistics of that whole program goal. we have certain CQI roles. I'm not gonna get into details about for it because we started that this year. We haven't tested it how it works out, but these are more about increasing. There are different roles for increasing the accountability of the CQI leads and the quality of the outcomes themselves. So, for example, if someone is saying we will increase 20% outreach, we have assigned more roles that will actually check the outcomes for the authenticity or for the quality of it. So I probably, if I get more time later on, I can talk about it. But we have certain CQI roles. um, Next is CQI meetings. So I was talking about these CQI teams, right? We have 10 teams. All those 10 teams meet 3 times a year separately. So team one is meeting 3 times in fall, in winter, in spring. Then team two, and likewise, all are meeting in fall, winter, and spring. These meetings are to discuss the progress towards the objectives that were created for a program goal, and then assigning and updating CKI score. Like I said, all the logistical issues. Um, Groups can meet more than 3 times, but 3 times is a minimum that we want all our teams to meet. We also have some requirements about the size of the CQI teams and the required quorum for all the meetings. Uh, we can. It's not that important right now. We can skip that. Okay, next is CQI conference. So we just discussed how the individual CQI teams meet 3 times a year. This is one big meeting where all the CQI teams come together to to discuss the whole year's work. This is the most important concluding element of our CQA process for that program year or for that grant year, because only due to this meeting all the work is done as we have discussed. So imagine being a CQA lead with nothing to update about your program goal at the end of the program year in front of almost the whole staff. So that it has increased the accountability of all the CQI leads and getting the work done the way it is supposed to, so that it could be presented at the CQI conference that happens at the end of of the whole CQI process. We call it conference because many reasons. One of the reasons is that I want to scale it up to our whole agency. Like I said, our programs exist on that spectrum of CQI, so not all the programs are part of our CQI, but as and when we make it bigger, I want to make it bigger and include more programs, probably more CAP agencies in Minnesota, in Ramsey County, and perhaps from across the country. We can include more um, agencies following the same process, so then we can create a combined CQI conference that happens once a year. Okay. Um, so the last element that we have is CQI management, or basically making sure that the whole process is centrally managed. We have an assigned person. In our case, it's me, who manages all the elements and does all the logistics related to this whole process, like sending reminders about creating goals or sending reminders about meetings, being in those meetings and seeing like how things are going, how, if people are attending those meetings, are they not attending the meetings, what kind of data is being discussed. I'm also the data person for the organization, so I have added responsibility of bringing a lot of information, excuse me, back to those meetings. So it's interesting. My deputy director, she always says a quote like, "If everyone is responsible for something, then no one is responsible for something." So having that one person who does or who manages the whole CQI process has been very significant. It had been very significant for our program because it's basically a part of my job, and I'm supposed to do my job and make other people do this job that requires CQI. Okay, so this is the whole process I've tried to describe in elements, but I also want to give a live demo of how it looks like. So let me see if you can you all see an Asana project open on your screens? Is it
So
visible?
Ankit, we see something that says program project CQI
Yes,
2024-25
yes,
at the top. Okay,
yeah,
yes.
yes. So
And
this one is
if just before you move on, can you confirm for us what that broad stands for? Big picture, results
yes,
oriented, organization wide,
yes.
aligned to the mission. And what was D? Is it directed or direction?
It should provide direction to everyone.
Direction. Okay,
So
thank you. We
directional,
were
it has to be a direction. So there's like it has to be broad, and just imagine like being a CEO of an organization, right? They don't necessarily do the payroll, right? But they provide a direction of like how it should be done. So they
Mhm.
should be directional. Broad
Okay.
is an acronym. It's used. I've seen that at multiple being used at multiple places. We follow that. We create our program goals every 5 years. Like I said, our main program is Head Start program. So we keep that in mind that it should be broad. It should be aspirational.
Thank you.
So
We were
yeah.
having a discussion in the chat, so thank you for
Okay.
clearing that up for us.
Sure. Sure. Um, are there any questions? Let me see the chat real quick. I'm sorry, I have like multiple windows open right now. So
I think that's it, Ankit.
okay, so broad was the only one. Okay, thank you. Thank you, Terry. Okay, so this is the project CQI from last year. We have 10 program goals. Let me open the 10 program goals that we have. So, program goal 10, children will develop something, and I don't want to read through all of them, but these are the 10 program goals, and all of them are assigned uh, a CQI lead, right? Just okay, let me step back a little bit. We use Asana for managing all our most of our projects. Project CQI is also like annual thing. We do it every year and we manage it on this platform. It's a very good. I'm not getting paid by Asana. You can use several other project management softwares that are available out there. There's one monday.com, there's Microsoft Project, there's Jira, there's like so many. So this is something that we already had in our organization, and we just continued using this. Um, so let me open this year. So this is this year's Asana project. Again, it's a copy of it. It doesn't um, matter which one I talk about. But yeah, now so let's talk about the very basic building block of this one, of our CQA process. So these are the 10 program goals that we have. Then we assign a CQI lead for each 10 program goals. Now, what happens is that CQI lead, they will put all the information in here. So like I said, they are basically the manager of this program goal, right? So this is how we write our program goals. And these are the smart objectives. These are the smart objectives, sorry, not the goals, but the smart objectives. The health service manager, in coordination with early Head Start family support specialist, will create and execute one health promotion strategy for early Head Start pregnant families to provide them better resources by May 29th, whatever the date, right? So that is then further broken down into different subtasks or action steps. They don't have any status. You will see there's no status other than just completed or not completed, right? Because all the three subtasks are completed here, the CQI lead went in and marked this as completed, right? And because this is complete now, it should receive 10 points. And I'm doing this as I'm going through it. Uh, and this becomes 0, right? So the CQI score for this program goal 1 at this point is 3. Let me delete this. I created this by mistake. Sorry. So you see how scores are working here? So the average is 3 right now for program goal 1. Likewise, we'll have different scores for program goal 2, program goal 3, 4, 5, 6, 7. Again, we are in the process of uh, um, assigning them scores and statuses right now. So once this is completed, well, let me open this one. Probably it will have scores. So for example, this one, program goal one last year received a score of 8. So that's like 80%, right? 60% for program goal two. I was responsible. I was the CQI lead for program goal two. Then program goal three, they received a score of 9. They were able to do most of the things that they promised except one. So it remained at 5. Um, Likewise, we take an average of each program goal, and then we create um, a program score. Now let me really quick throw in our CQI report that I created once. What is it called? Simple. Just give me 1 second. I'm trying to pull um, our CQI report. We created once, and then we um, included that report in our annual report, or made it as a part of. Oh, just give me 1 second. I'm sorry. Should have kept it open earlier. But so, okay. So this is the report I created in 2023. It talks about all the whole philosophy, road to CQI, and our program goals, and then individual scores. And then we have all the meetings when they were done. These are the scores. So our overall program scores was 7.5 towards the end of our program year. So this is like an example, and it's on our website. I will drop the link in here, um, or I'll send the link to Terry, and she can include that in the email. But that's how our CQI looks like. Let me open this chat. I lost my presentation. Sorry.
It's hard
Okay, that was a
toggling back
demonstration.
and forth, Ankit.
That was a demonstration. Yeah,
Yeah.
it's always I like talking about the live the activity, how it's happening, so that everyone can see how they can also do something like that. If they can if they want to take some kind of inspiration, that's also good. And again,
We
even
did
if
have a question.
yes.
Michelle wanted to know, well, first Michelle asked, is the tracking mechanism noted as well in your Asana? I don't know whether you call that a workbook.
Yes. So tracking, by tracking, do they mean the main outcomes? How are
I think,
we noting those outcomes in our Asana? There is Asana provides the ability to put notes in there. Again, we are also in the process of implementing. We create new things every year, and perhaps this would also be an objective, perhaps next year, to document everything on Asana, rather than, I mean, we try to document everything on the objective themselves, and then we have assigned roles that look into those measurements or those outcomes and outputs.
yeah,
uh, we do not necessarily put that in Asana at this point,
okay.
but if you want, you can put it. So like I said, like, let me just throw this in right now. So like this one, you have the ability to like take notes here, tag people, add notes. Like for example, this is uh, in one of the objectives we did attach the policy. So it talks about creating a policy, and then we attach that policy in Asana, so that whoever is reviewing this, they can review that this work was completed. So I'm not sure if that's the tracking mechanism you're talking about, but yeah, it does allow
Michelle
you.
also Michelle also asked, how do these align with Roma reporting?
Yeah. So, like I said, mostly we are using this in our Head Start program. Um, with Roma reporting, we have a different set of Roma objectives and a different set of Roma report. Um, Probably we'll have to align our executive office with this process. Again, we are on the spectrum somewhere, they are on the spectrum somewhere, and we have not aligned them. But we don't have uh, a direct one is to one connection with Roma. But like I said, in Roma you have outcomes and then outputs. um, we have tried to build that in our objective itself, so that if need be, to put this in a Roma format, or that table that we use for Roma reporting, we can easily just take our outcomes and outputs and the impact and everything and just submit it as a report. Okay, so I was talking about road to CQI. I did not want to spend a lot of time on it because we created this process. Like, I'll be very honest, we created this process uh, in its current form 3 years back, and I wanted to come up with a fancy acronym and try to align this whole thing with that acronym. So it does make sense. Like, we are redefining quality every year. So basically what it means is we are setting up quality measures for ourselves, which are very definite. They are not vague by any chance. Very definite measures of quality we are redefining every year. Then we optimize quality in terms of, should it be 2% or should it be 20%, right? We have to be realistic. One of the tenets of smart objectives is that it has to be attainable and realistic. So to optimize that quality, should we say 2% increase? Should we say 5% increase? That is what happens during those meetings. Then we assess that quality. We look at, again, how are we doing throughout the year. We assess that quality, like, are we reaching there, are we on the path to reach the objectives that we set. Then demonstration of those quality measurements internally, like for the team, like, hey, we are achieving this. And demonstrating externally, that means that CQI conference that we talked about, that is, I would say, that has created the most impact for us. Because um, again, imagine, like, you are a CQI lead and you did not uh, do any of these promised quality work that you promised at the beginning of the program year. Then it would be a little difficult for a difficult situation in that CQI conference. So that is how we do CQI. And I think that was the presentation, unless there are other questions that I can answer. Again, I could have taken 2 hours to present this. 2 hours would be less. Um, but I tried to wrap everything, like whatever I can, in whatever 45 minutes, so that I can have 15 minutes for questions and answers.
Thanks, Ankit. There's some conversation in the chat. If you uh, uh, can keep your slides up, but maybe pull up the chat. Sarah has a comment there that I think you could probably address, as well as Michelle. Um, I do want to encourage you guys to go ahead and grab this QR code, and I'll pop the link in the chat if I can figure out where I saved that. But if you don't, if you would like, come off mute and ask any questions that you may have. And Ankit, if you've had a chance now to skim through those, do you have any
I
feedback you
did
could give us?
skim through the questions. There's one about Roma reporting. I think I addressed that. Um,
Then the one that starts out, I think where it says, obviously a champion is critical to this. And then there probably needs to be some conversion of folks. Do you see that comment? I'm trying to get it
yes,
over to you.
that is a real challenge, and that is something that even I'm facing in our organization. That is the resistance to any process like this. People have been here since a long time. A lot of people do not want to change the way things have been done. Um, so again, the spectrum, that is where that spectrum comes in. And like I said, as an organization can exist at multiple levels of that. Um,
Yeah.
Yeah.
A lot of people don't. I personally like change, Michelle, and it sounds like you do as well. So the comments I think Ankit about you know how you um, tackle meshing your CQI processes with existing data collection and like Roma reporting and all of that. I think that that is where a lot of folks are in terms
Yes.
of, just like always, it's those silos, right? So how do we break down those silos? And so correct me if I'm wrong, but just recounting some conversations we've had, is it correct to say that you started in Head Start specifically because of that is a significant program at your agency,
Yes.
and that once you feel like you've got these processes down, there is a plan to then take it organization wide. Is that a
There
correct
is.
assessment?
Let me start from the very beginning. Like, we have been doing CQI, and I think all of us that are in this meeting room, all have been doing CQI in some way or other, right? When I was talking about the spectrum, I was talking about the journey that we had to make over several years. So I would say I've been working on this since 7 years, and we have been changing our process every year of those seven. We had changed our process uh, probably 7 times now, because it's been 7 years. We have changed every year. Um, it is an iterative development of the process. When it comes to our Head Start program, we are totally into it. Like, our whole work is governed. Our whole work that is not compliance is governed by our CQI process. So when it's so funny because sometimes we get these federal reviews and we talk about the CQI process, and it's the highlighting thing because we can quantify the work that we have done, the impact that we have created on a standardized number, right? Like for example, if someone asks what's your what does your customer satisfaction looks like, so there always has to be one score, like it's 85%. What does your CQI look like? Oh, 85%, 75%. It's okay. It can be 75%. We do not expect us to achieve 100% score. We do not expect, because this is above and beyond. And again, if we are achieving 100%, probably we underestimated what we could have done. So so um, it did not happen overnight. There were a lot of hit and trials, like we tried different things. So we used to have something called data committees before CQI committee were a thing. We had data committees, and like I said, we had vague objectives. I wish I had a presentation from like 7 years back open, and those objectives were like, we will increase our child outcomes. Let's just say, for example, outreach is a good example I take all the time. We will increase our outreach to our families. But then, how do we know that you have increased? Like, what is your achievement threshold? Are you going to increase it by 2%? Are you increasing by 10%? Just saying that, even when you write the grant, right? Like, we have started writing grants which are very accurate. We are like, we wanted to increase 20% outreach. We achieved that, or we did not achieve it. I mean, being very open about like what we have done, what we have achieved, what we couldn't. It's much more easier than just writing the same thing. Oh, we increased our outreach, and that's about it, like making it very vague. So when it comes to Roma integration, like Roma also wants you to have some output and outcome, and so does this process. And again, this process is created so that your Roma reporting is also, it kind of adds to your Roma reporting directly. Um, but also it's not 1:1. Like, you cannot just put a CQI report as a Roma report. So, Michelle, do you have a question?
Michelle?
Okay, hi, sorry. I was just thinking about, how these kind of all overlap. And I'm a big fan of project management software. I think it's very efficient and it does allow for a lot of people to be able to access the same information and contribute and participate in the work and the data collection. One of the things that I have this vision. Forgive me, I'm old, so I think about like transparencies, on the overhead machine projector and how you have like, here are these, and then this other page overlaps, and how do they all intersect? And so it's like this very visual um, idea of making sure that things are integrating in terms of that data. So I just would hate to see like duplication in collecting or reporting when you might be collecting for one program or working on these goals for one program, but they also apply to the same goals to be achieved through Roma. And so, how is that information funneling in to make sure that the agencies are reporting as a whole? I don't know if that makes any sense. I'm kind of rambling.
It does, Michelle. If I'll try to answer that question with a caveat that we are still working on aligning our Roma and our project CQI. Um, we have a different set of Roma objectives, which are not a part of our CQI at this point. So, and I don't have a document that shows our Roma objectives, but it's a completely different set. There could be some commonalities or overlap between these objectives and Roma objectives. But again, when it comes to these products like a Roma report or a CQI report, these are the reports that are created once the work is done, right? So, like, we are taking some of the work that we do, we are taking and putting that in Aroma, and we are taking some of the work that we are already doing in our CQI. So there could be commonalities, but again, like, we are still working on like straightening this out. Um, so there's still CQI left in our CQI process.
Right? Yeah, exactly. And I think, Ankit, I think that you're kind of teasing at something that we hear from folks a lot as we try to, talk about performance management and performance improvement and CQI. So CQI is often deployed in small um, areas, right? And like you identify an area for improvement,
Yes.
and then you develop and deploy a small test over a short time so that you can get that data in a meaningful way and course correct, can either deploy that more fully or make adjustments in the objectives. So it really eventually CQI across an organization might still look like it's programmatic because that's how you want to tackle it, right? You want to tackle it data point by data point, opportunity for improvement by opportunity for improvement. And so that cycle, that CQI cycle, is done internally within the program. Eventually, those scores could be rolled up into an overall agency CQI assessment, though. Is that accurate?
That is spot on,
Right.
Terry, because
Yes,
this
Michelle.
allows us for internal improvements also. Like,
Yes.
let me find an objective that was about our internal um yeah, like this one. The health service manager will develop a procedure. So we are developing a procedure that is an internal thing, which may or may not, perhaps not go on like on the
a,
remote.
a report, right? That may never see the light of day outside your team.
Yes, yes, that is correct, Terry.
Yeah. Yeah. All
Yes, so
right.
when I say Roma objectives, yes, I was referring to the CSBG annual report that goes. Yep.
All right. Well, I think folks are starting to get hungry, perhaps. Uh, any other questions? Anybody have anything to add? I will ask again, when you complete your survey, share with us additional information. I'm sorry, additional topics that you would like information on. We're in the process right now of planning additional peer data webinars, but we are also open to hearing from you in terms of trainings and, cohorts, those types of engagements that would help you guys internally to improve your organizational capacity. That's what we are here for as a team, to really be responsive to your needs, especially as it comes to organizational capacity building. So with that, oh yes, thank you, Ankit. Hopefully we will see many of you, if not all of you, in Orlando later this month. We hope you can join us there. Snag that QR code if you have not registered yet. We look forward to it. We are at a Disney um, um, location, so there's that. Um, and again, please complete your evaluations, and we will send out information when we got that next peer data webinar uh, set up, and join us for other sessions as well. Thank you.
Thank you, Terry.
Thank
Thank you,
you.
everyone.